patient who has full weight bearing, maybe I have some weakness, but I'm allowed to have full weight bearing, okay? If I want to teach them the slowest, most conservative gait pattern, what am I going to choose?
4-1.
A 4, if I'm using 2 assistive devices, I'm using a 4-point gait pattern. So, okay, I advance a crutch and the opposite foot, crutch and the opposite foot. What is this again? 4-point. It's my slowest, most steady with 2 assistive devices. 4-point. Opposite, 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 opposite. Arm, leg, arm, leg. Now, if I have this, what gait pattern is this?
2-point.
2-point. Why is it a 2-point? I'm advancing my crutch and my opposite foot at the same time. Exactly. That's the difference between the two. Okay? So there's my 2-point. Okay? Let's say I'm a person who had been using 2 crutches and I'm full weight bearing, okay, but I'm still kind of weak, maybe because I had an old injury, and I'm ready to move down to just 1 crutch. Okay? What would this pattern be called?
4-point modified.
It's a modified 4-point. Why? My crutch is advancing by itself, then the bad foot, then my good foot. Okay? Sorry, I'm going to get my scrunchie so everybody knows which is my bad foot. Okay? Can I use this for a non-weight bearing pattern? No. Okay? Only for a full weight bearing. But I have one leg that's bad. Okay? So, my crutch goes, then the bad leg, and my crutch is always opposite of my bad leg or my assistive device. Why is that?
Balance.
It helps with balance, it widens my base of support, and because I can't stand the full weight on this, I can shift it off of that. If it's on this side and I'm trying to shift it off of it, am I shifting off of it? No, not really. I'm shifting towards it, okay? So it's got to be opposite the bad leg. And where do you guard if you're the patient, the therapist? You guard on the bad side. So I would be standing here. People always fail for that. Stand on their bad side, because if they fall, they're going to fall where? Towards the bad side. Okay? So, tell me what pattern I'm doing. Modified 4. Why? Because my crutch advances, then the bad, then the good. Okay? So what's this? Modified 2. Why? I'm advancing my bad one and the crutch at the same time. Okay? Does that make sense? Okay, good. All right. If I am totally non-weight bearing, what kind of gait pattern am I going to use?
3-point.
3-point. I'm always going to use 3-point. If it's non-weight bearing, it's 3-point. Okay? So I could do that with crutches. Okay? My crutches go, and then my good foot comes. Okay? Notice I'm not up here. Okay? Because that doesn't really it doesn't replicate a more typical walking pattern with my foot up there. So try and encourage them to be as close to a typical gait pattern as you can. I can either do a swing to or a swing through. Okay? Which is quicker. The swing through, but it's probably a little less stable. Okay. But anyhow, it's either way, it's a 3-point gait pattern. Non-weight bearing. If you see non-weight bearing, you're going to pick which one? 3-point. That's right. Okay. If it is a modified, well, let's hold on real quick. Because I could do that with my crutches. I could also do it, let's say if it was somebody that was a little older, I could do that with a walker as well, right? Okay. So if it's an older person, are they going to feel more comfortable with crutches or a walker? A walker. Okay, so I'm still non-weight bearing, and I'm in my 3-point. Okay, if I am a partial weight bearing, what can I choose?
Modified 3-point.
I can use a modified 3-point, okay? So, let's see. Where did I put mine? So, is everybody understanding at this point your gait cheat sheet? Okay. What was I going to say? Because I want you to also look at the last column, okay, to make sure you know what your choices are when you then choose your assisted device, okay? If it is a regular 4 or 2-point, you have to have